So our first question is, can you tell us about your journey all the way from undergraduate studies to medical school to residency and to where you are now?
Sure. So I was at Columbia for undergrad, where joined the ambulance corps at Columbia, which was my first sort of experience in medicine. Absolutely loved it. Studied biomedical engineering, and then did like the whole pre-med thing with the MCATs and all that, and then applied to medical school. Ended up going to Columbia for medical school, which and went straight through, which was I think it's becoming less and less common almost, where a lot of more people are taking time off either to get their pre-med requirements or do some more research or what have you. I just have never been the person that like needs too long of a break to kind of keep things going. So I just kind of went right through. Having been in engineering, like very quickly started realizing that like I needed sort of a more tangible choice when I was in medical school. And so, obviously the first sort of dichotomy is medicine versus surgery, and always knew that surgery was kind of more of my line. And then during anatomy, quickly realized that, in terms of engineering, orthopedics is a field that kind of fits really well with it. So, went through medical school, kind of having a sense that that's what I wanted to do. But obviously during your rotations, you have to kind of keep an open mind. And that's probably the first piece of advice I'd give is go through medical school not committing to one specialty. Certainly okay to have interests and explore things and shadow people that you're kind of interested in emulating, but never kind of close off, because what ends up happening is you just don't pay as much attention to things that aren't directly related to the thing that you're interested in. And as a result, you kind of miss out on large portions of your education. And even now there's things in dermatology or medicine or cardiology that it's just so nice to be able to know what's going on with your patients outside of just the one thing that you specialize in. So did that, and then also started doing some research in the fields that I was interested in, which in my case was orthopedics. Got involved with a lab that was pretty productive. And that's another piece of advice I'd give is, before you sort of sign up with someone, just get a sense of what their output is. If they're putting out if your mentor is putting out one paper every 2 years, that's not someone who will kind of help beef up your resume, so to speak. You also, not to say that you don't want to be involved with that person. If that's someone you admire, like definitely, develop that relationship. But also, I mean, it's just getting so competitive, and programs really want to see research on your resume. So definitely find a lab or a group of researchers who are productive and kind of pair up with them. And the nice thing was that, the sooner you get involved, the sooner that you'll get a chance to sort of take a lead on projects. And so ended up, kind of having a handful of projects that I was the point person on, which was great learning experience. Not just in terms of, publishing papers, but also learning like the fundamentals of research, asking the right questions, developing sort of study designs, things like that. So did that, did a lot of shadowing. Then towards the end of medical school, you start kind of honing in on where you want to do your away rotations. So definitely have a wide variety of programs that you kind of go and visit. Here, I don't know what it's like in Canada, but here you generally do 2 or 3 away rotations at programs, which are, essentially like tryouts, where it's like a month-long interview where you're kind of showing up, going through the routines of everything, and they're hard. That was one of the hardest portions of medical school, because you just want to, you're kind of always on. That's not a time to sort of focus on getting a lot of sleep. It's more of a time where you're just kind of learning as much as you can, absorbing as much as you can, showing everyone that you're a good fit, if you are a good fit, obviously. And then ended up interviewing and matching at UCSF for residency, which is great. It's nice thing about residency is that you have sort of a, set timeline of where you're at in a place. And so definitely nice to kind of set yourself up if you want to go to an area where you eventually want to live and practice, because then you kind of get to know the people there. But it's also nice if you just want to explore a different part of the country, or, just experience a different sort of culture for a while. And so I was on the East Coast for all my education, and going out to California and San Francisco was awesome. And it was nice to know that in 5 years, if I wanted to change, I would get that. So did that, loved my residency experience, like really felt like it was a great fit for me. And that's probably the biggest thing that I would advise is like, yeah, you want a place with like a good name and reputation and all of that, but really you want a place where the philosophy of that program kind of matches where you see yourself going, so that you are set up in an environment where you can succeed. So did that. And then again, kind of kept an open mind in terms of subspecialization, focused a lot on trauma and joint replacements and things like that. And then ended up really liking spine. And so then applied for fellowships. And now I'm at Rush in Chicago, where I'm doing my fellowship here. And then ended up, the beginning part of fellowship, you really kind of start looking for a job almost within the first month or two of your fellowship. And I'm joining a private practice out near Boston, where my wife's family's from. And we'll be heading out there, obviously doing mostly spine, but also taking general trauma call. And so, kind of all parts of my orthopedic education are going to be utilized, everything from, hip fractures to infections, hand, a little bit of everything, and then mostly spine. So it's kind of the story.